Thank you for joining us tonight. We are honored to have the First Lady of Massachusetts join us this evening. Before we start our fireside chat, I'd like to recognize some special guests. Tonight we have with us RI Trustee of the Rotary Foundation, Julia Phelps. We also have Rotarian and CEO Scott Dahl and Rotarian and President David Cochran, both of the Global Impact Group. In addition, I believe we have some of my district governor classmates with us this evening, as well as Rotarians from our surrounding New England districts. Couple housekeeping items before we begin. Please type your questions in the Q&A or question and answer box related to tonight's topic, which is the Massachusetts Coronavirus Relief Fund. And we will try to get to your questions during our program. And so now, if we can have the slide for the flag, I would ask that you all rise and say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So I'd like to introduce our moderator for this evening, Lori Karras. Lori has been a Rotarian for 5 years, and she currently serves as an assistant director, the district's assistant secretary, as well as the district conference co-chair. She also was previously the Boston 7 Rotary Club president for 2 years in a row. So please join me in welcoming Lori. Thank you, Lori. It's all yours.
All right, all right. So I have this amazing opportunity and pleasure to introduce Lauren Baker, which I hope that maybe we'll be able to see shortly on your screen. Oh yeah, there we go. Hi, Lauren. So Lauren Baker currently serves as the First Lady of Massachusetts alongside her husband, Governor Charlie Baker. As First Lady, Lauren works to improve the lives of the children of Massachusetts, focusing in particular on children served by our Department of Children and Family. And Lauren is a veteran of the advertising world, both in New York and in Boston, where she led and managed development of brand campaigns for consumer products, technology companies, and nonprofit organizations. And today, our First Lady, Lauren, works as a marketing communications consultant. She builds brand strategies for independent schools with the Baker Group. Her continued passion for service and local responsibility is evident throughout her career. And her current work to increase awareness and raise funds for a number of causes like the Massachusetts COVID-19 Fund, which we are eager to hear more about. And she also serves on the Regional Board of Directors of the American Red Cross of Massachusetts and is a founding member of the Tiffany Circle Society of Women Leaders. It is an honor and a delight to have you with us this evening, so thank you, Lauren.
Thanks so much. I'm thrilled to be back again with this Rotary District, 7930?
Yeah.
It's a pleasure to be back with you guys, and I'm honored to be invited. So thank you for having me.
This is great. So just before we get really into our fireside chat, District Governor Joan has already mentioned this, but just want to bear mention again that if you do have questions, we do encourage that you put those in the Q&A section, and you can find that towards the bottom of your screen. You'll see if you hover around towards the bottom of your screen, in the middle of your screen, at the bottom it'll say Q&A, and you can pop that up, and that way you can see, start typing in your questions as we go along. So I just wanted to mention that one more time before we get going. And Lauren, I believe that you had actually invited some people within your crew to join us this evening as well. Have they, do we think that, is it Jordan that may be with us?
Jonathan Raymond is the fund's executive director. I'm not sure if he's on or not. He was going to try to make it. I hope he's here because he, as a lot more of the sort of day-to-day deep dive information than I do. So I hope he's here.
Jonathan, if you are with us, if you could just post something.
There he is. I saw him. He's here.
Oh, okay. Good. Oh, awesome. Well, I'm thrilled that you're with us, Jonathan. Thank you so much for being here with us. And so, as you know, Rotarians had the opportunity to submit some questions. Governor Joan and I also added to that list. And as we mentioned, people will have the opportunity to post questions and answers kind of live as we go along as well. So we'll do our best, everybody, to get to all of your questions. If we miss asking one of your questions, please don't take offense. We're trying to also manage time. So in our quest to do so and honor time, why don't we start our chat, our fireside chat. Do you like my background?
I do. Very nice.
Isn't that nice? I actually am sitting in the fireplace, it appears. So I'm not as clever as some, so I just thought that this was really cool. So one of the questions that, has been burning, no pun intended, to my fireplace, is, COVID-19 happened. And, when I think about learning about the foundation, I felt like COVID-19 happened. It became very well known. It was kind of like, oh, there's this disease and we're calling it COVID-19 and people have it, but all of a sudden it was in full swell. And around that same time, it was Lauren Baker, First Lady Lauren Baker is in the news. She started a foundation. There's already $11 million in it. How did you decide to do this and get such traction, what seemed like so fast, to the public?
Well, as this is something that, kind of, it came like a tsunami for all of us. And as soon as it became apparent that this thing was a very real and long-term disaster that was going to wreak havoc on people all over Massachusetts. My husband and his team really sort of jumped into disaster mode immediately, and I wanted to be helpful. I wanted to be able to take some sort of action, to be involved, to make a difference. Like all of you, I'm somebody who has to do something. I can't just sit here. And at that point, my husband was really concerned about people all over the Commonwealth who, through no fault of their own, might find themselves in need. And in addition to, these are people who may never have needed help before. And in addition to those, there are a lot of families in Massachusetts who, even on a good day, might struggle to make ends meet. And those people were going to be disproportionately harmed by this pandemic. So we pulled a small group together and worked really hard to stand this fund up. This is an emergency relief fund. We had to be able to stand it up and make it work as fast as possible. And we were lucky that we had, the Boston Resiliency Fund had started a week or so, maybe 2 weeks before us. So we had that as an example to follow. But what we had to delay a little because we were waiting to see what the feds would do. Initially, we weren't sure if which populations were going to get aid from the feds, and we kept hearing that it was coming, and so we sort of delayed a little bit, but that was good because it gave us a little extra time to model this fund and to raise the initial $13 million, which is what we launched with.
Wow.
Yeah, it's We stood it up very, very fast, and it is largely due to the generosity and the brain power of Joanna Jacobson and the 1-8 Foundation, who helped. They helped model the structure and the organization of the fund, and they also, Joanna worked really hard with a network of incredibly generous philanthropists who
Wow.
seeded the foundation with the first $13 million.
Wow, it's just incredible. I know that it's also affiliated with Boston Foundation. And I think Eastern Bank has generously been participating, kind of managing the funds, if I'm not mistaken, as well, right?
Right. So we were incredibly lucky to have the 1-8 Foundation and their brain power, and then Eastern Bank volunteered to do a couple of things. One is they are a fiscal sponsor along with the Boston Foundation, and they are also helping with the sort of technical operations of the fund. And they are hosting our website through the Foundation for Business Equity, and they pulled in a company that can process the online donations, which, without Eastern Bank, we could never have pulled this off. So we're extraordinarily grateful to them and to the Boston Foundation for helping us, process these donations through donor advised funds. So it's, it is a real team effort. And I think we've all seen in the face of disaster, people are willing to relax the rules a little. People are willing and excited to think outside the box to solve problems in a different way. And we've definitely witnessed that everywhere during the course of this pandemic and the response. You see people reworking factories to make masks when they used to make vacuum cleaners, and figuring out how to make a veterinary ventilator work for a human being. It's incredible. And we really were able to ride the wave of that sort of disaster response mentality. And it has been an incredible journey so far.
I mean, just watching it from this angle, it certainly has been, and it's clearly something to be proud of, not only for yourself, but just, for us that are, Commonwealthers. We get the opportunity to be proud also. I don't know how many states in the union have the opportunity to really say that there was an opportunity to step up, and I'm sure that there are a whole host of funds certainly throughout the nation, but when we think in terms of something that's specific for Massachusetts and done in this way, I know that there's a lot for us as constituents of the state of Massachusetts to be proud of. Can you tell us a little bit more, kind of do a little bit of a deeper dive around who the foundation is serving? How are you thinking about, where do these, you've cultivated a lot of funds. I know you're over 20 million that you've kind of gleaned at this point. But when you think in terms of how are you determining, how are the funds, who are they serving, and how are you distributing that?
Well, the fund will serve people who have been disproportionately impacted by the this coronavirus health crisis and the economic downturn that accompanies it. And we're talking about essential workers and other vulnerable populations around the Commonwealth, including immigrants and the disabled and the homeless, and people who are facing food and housing insecurity and the loss of critical services. And the fund is intended to fill gaps in resources. We are all aware that there are, that it's sometimes difficult for nonprofits outside of Boston to have access to the bigger funders that are there, and we're aware that there are pockets of great need all over Massachusetts, not just Boston. And so we need to make sure that people in every corner of Massachusetts who are in need have access to the resources that they need and deserve.
So how are you determining that they're, like the criteria, if you're, is it that you're getting applications in from nonprofits or applications in from people, or is it cities and towns saying we have this need? How does that process work? Can you tell us a little bit more about that?
Well, this fund is set up to be a time-limited emergency fund. So this fund will not exist long-term. And in order to stand it up as quickly as we needed to, we had to take advantage of existing infrastructure. So we've chosen to work through a robust network of community foundations across the Commonwealth who have deep roots in their community. They really understand and know the people that they serve. They're familiar and have relationships with the excellent nonprofits that serve their communities. So with Jonathan Raymond, who is the executive director and a huge professional and an incredibly patient man, joined us in the very beginning, and his hair has been on fire for 6 or 7 weeks now. Establishing a relationship with all of these community foundations so that they can assess the need in the territory that they serve, and then determine and identify the best nonprofits to fulfill that need. And then they come back to us with grant recommendations. And the advisory committee and Jonathan and his team will approve the grant recommendations made by the community foundation. So we're trying to focus on emergency relief and humanitarian aid on an emergency basis. So and that's going to be food and housing and financial assistance, and we're seeing a lot of interesting kinds of needs come up, but it is the local infrastructure that is identifying the need and prioritizing how we serve and who we serve.
Jonathan, are you there?
Jonathan's muted there he is. I mean, do you have anything to add to that? Everybody, this is Jonathan Raymond, who I'm so grateful he decided to take on this challenge.
No, I think you've said it really well, Lauren, which is the needs are identified at the local community and grassroots level. And then, we are checking them to make sure that that there's a good fit with the fund's focus and priority, and that these organizations are nonprofits. They're all nonprofit organizations, and that they actually are going to deliver on what they say they do, and that they will do, which is not always expected during a crisis. But we really want to provide both expediency. We're telling the foundations that we expect their grants to be out within 72 hours. I'm happy to say that with many of them, they're out in 6 hours.
Wow. Oh my gosh. Wow. That's unbelievable. Wow. Wow. That's just insane. Lauren, a moment ago, you mentioned that you're getting some unique requests. Maybe you can tell us a little bit about some of the more unique requests that you feel like you're getting that maybe you weren't anticipating would have been in a list of requests and asks.
Well, it's not so much that they're, Jonathan would know better than I if there are things that came like out of left field. But what is really shocking to me, I think, is the incredible need in Massachusetts for food. I mean, that has been, from the very first start of this, I think the majority of grants that have gone out are to food distribution, food, to the food banks, to food pantries, to all sorts of organizations who have figured out how to distribute food and meals and that kind of thing. And it's shocking to me, eye-opening maybe, and a little bit frightening that there are that many people in Massachusetts today who are not sure where their next meal is going to come from. And so that's been really eye-opening to me. And we're doing a lot of financial assistance, like for to help people pay rent, and to prevent people from being evicted.
Yeah.
We're starting to see, we get a lot of requests for PPE, for masks and things like that for smaller organizations who have, who use essential workers, or who need to interact with the community in order to deliver food, for example, to provide home visits for disabled people, that kind of thing. We're doing that. We're also trying to leverage the connections that the members of the community and the 1-8 Foundation have, to make sure that, if somebody's asking us for masks, we want to make sure that we help them connect with a viable vendor, somebody who's not going to take their money and then not deliver masks, or promise them one thing and deliver another. We want to make sure that the resources that we're providing to these nonprofits are used, that we're stretching every dollar to have the greatest possible impact.
That's really interesting. When you talk about food, it's certainly eye-opening. And I know that there are Rotarians on with us this evening who are part of the nonprofit world, and supplying food to our community. So I know that there are those individuals that are with us this evening, and you can't see them, but they really are out there. Were you thinking that, is it certain, is it demographics that you weren't anticipating would be among the need? I would imagine it's unfortunate, like kids, so many kids get their meals at school, and school is closed. School will be closed, is now closed for the balance of the school year. Is it children that you're seeing this? Is it more on the senior citizen side, or is it really like the more traditional average family of X, 4 or 5 people, and that you thought would never be among those? Like, when we think in terms of the population, is that what was surprising to you? Like, who specifically needs it, or was it aligned to what you were thinking could possibly be the case and you just were hoping wasn't going to be the case?
Yeah, I mean, there's definitely that. There are a large number of families who've never needed to access resources for food before. Yeah. And, and there are cases where people may have, they may have the money to buy food, but they can't leave their house, or they can't go to the grocery store. They don't have transportation. They're afraid to take public transportation. There's so many things that impact people's ability to access food. And, and we're learning a ton about the sort of the supply chain. And Jonathan can add to this, but we've seen an incredible strain on the food banks that serve. There are, I think, 4 food banks that serve the Commonwealth, and the Boston Food Bank is the largest. and does millions of pounds of food every year. But the fact that I heard about them in recent weeks was, they serve basically Eastern Massachusetts, and they used to always have something like a 21-day supply of food in the food bank. And that, because of demand, has dropped to like 8 days. Wow. And because food pantries all over the place are drawing out of the food bank, and restaurants are no longer making the donations because the restaurants are closed, so they're not making donations like they used to. So it's a very complicated supply chain, and it is stressed like we've never seen it stressed before. And all of us are seeing it in our grocery stores, where, when you go in and the shelves are bare, it's incomprehensible.
It's mind-boggling. There's no Lysol, Lauren. You cannot find it. Doesn't exist. No Lysol. Nothing, like just simple stuff. It's unbelievable. It truly is unbelievable. When I think about how the funds are distributed, is it always that it's monetarily based, these grants, or do you sometimes, or are some of it converted, if you will, into goods and services? For example, food that goes to the food bank, or is it money and then they convert it into the food that goes to the food bank, or PPE, or whatever that the monies are intended for? Are you part of that supply chain, or are you moreover the supplier to the funds that will then get them what they need?
Right. This is the Massachusetts COVID-19 Relief Fund provides grants to community foundations, who then provide grants, in financial grants, to nonprofits, who will then, deliver whatever it is. So if so they're going out and purchasing whatever it is they need to do to deliver the service. Sometimes we're supporting capacity building. So we're supporting the organization's ability to hire more staff, or to, buy more supplies, that kind of thing. So yeah, this is all financial, and we don't have, we don't accept, or we don't take applications from nonprofits. We don't have volunteer opportunities per se. And we don't accept in-kind donations. People who are interested in volunteering or doing in-kind donations or creating their own fundraiser, there's lots of opportunities like that in the communities, and I'm asking people who want to do that to contact the closest community foundation to them to find out what they can do to help.
Cool. I have other questions for you, but we know that there are questions in our audience. So one is a question, and one is a comment that I'll provide to you too. So one thing that I'm seeing in the chat is, so First Lady, when do you ever see your husband? Like, are you, he seems to be 24/7 on the news and, out and about. So, one question is, do you ever see each other? Like, you're both so insanely busy.
It's very kind of you to even think about that. I mean, this is the job. So I don't know. No one's ever done this before, but we've had some experience with working through disaster in the Commonwealth, and so I knew when he missed our family vacation to start this thing off, so I knew it was going to be like this. But yeah, we see each other. He does come home. He's alone in the State House, which is pretty interesting.
Oh my God, that'd be scary.
Yeah, I mean, the only time he sees other people is during the press conference. The rest of his day is, he's alone in his office and no one's allowed to go in there. And he does Zoom calls like the rest of us all day. And yeah, I mean, this has really been a 24/7 effort, because there's no guidebook, there's no great answer that that will make everyone happy, and it's been a real challenge. But I'm really proud of the way their whole team has pulled together and relied on the data and pulled a lot of the incredible expertise we have here in the Commonwealth into the problem solving around all these incredibly hard questions. So yeah. I see them a little, hardly, but mostly I see them when we're not awake.
Well, that's good. Someone else had sent in a question, really was a comment. It was just a sweet comment where they were like, we recognize that no decision, when you're weighing all of the decisions that need to be made, not everyone's going to be happy schnappy about every single decision that you make. And you can't appeal to absolutely everybody. I can only imagine how challenging it is to constantly be weighing and measuring what makes sense for the greater good, knowing that some people may not be super duper pleased with you. But the comment that was also made was really around how proud we are as the people of Massachusetts to know that we have someone who's really paying attention to a lot of the, you're taking away the noise of the commentary that's out there and really simply focusing on what are the facts, what does the data tell, what makes the most amount of sense, knowing that not everyone's going to be thrilled. Maybe a decision isn't the popular decision, but knowing that in your gut it's truly the right decision. So I guess on behalf of others that posted that sort of question, or commentary, I want to make sure that it's portrayed to you and to your family, because I'm sure that it's just in the team, because I'm sure that it comes with wild challenges every day. So I wanted to convey that on behalf of the Rotarians that sent in that sort of sentiment and portray that to you.
Thank you.
Yeah, our pleasure. So another question was, how much of the fund has been distributed so far? And Jonathan, I don't know if this is something that you want to chime in on also, but.
Yeah, Jonathan, definitely chime in. The fund will do. We're trying not to overwhelm these community foundations, and we want to make sure that they're capable of pushing the funds to the nonprofits in the way that they planned, and so so that the funds are being used effectively. And so we're doing waves, and so about every other week, funding is going out across the Commonwealth according to the grant recommendations that we're receiving. And so we've done 2 waves, and we'll do it sort of every other week until we spend down the fund to 0, which right now looks like it will be the middle of the summer, maybe July, end of July. Go ahead, Jonathan, add the color around that.
Happy to help a little bit, Lauren, on that one. So through the 2 rounds or the 2 waves that Lauren mentioned, we've granted out a little over $5.8 million, which has helped and is supporting over 240 organizations and nonprofits throughout the Commonwealth. And we have another round that we are taking a look at this week, and once this week is through, we'll be actually close to $12 million, and over over 200 plus organizations that will have received this support throughout the Commonwealth. So it's as Lauren had mentioned, the fund was started on April 6th. So we're really getting going and making sure that these resources get out to those most in need throughout the Commonwealth.
Wow, that's incredible and certainly impressive. A couple of other questions that have come in is, one is from, is Worcester Community Foundation a place to contact for funds? Is there a limit to how much funding a nonprofit can ask for?
So Worcester Community Foundation is one of the partners that we are working with, and they ought to have those conversations with the foundation team. They have a very strong team there that's working collaboratively with the United Way as well as with the city and the city manager. So, based upon what their needs are, that's how the requests come back to us at the Massachusetts Fund.
Awesome. That's great. Thank you for that feedback. Another one is, it's unfortunate. I think I saw the statistics today that showed that Massachusetts has lost about 5,800 people to COVID-19. And obviously there are other people that unfortunately pass away during this time that are not related to COVID-19. And being able to go through that grieving process has changed dramatically as a result of this. One of the questions, and we've actually, I know in Rotary District 7930, and I'm sure in other districts as well that are joining us this evening, they've had Rotarians that have passed from COVID-19. So it has certainly hit close to home, more than just our personal families, but our also extended family. And I know that this is a little bit on the, Governor Charlie side, but what are the thoughts around, in your perspective too, around being able to grieve and go through that grieving process, even if it's to be at the cemetery and so forth? I mean, every religion has its own method for caring for grieving, but what are your thoughts or perspective on that? I think that may be a phase 2. I can't remember, but that may be on phase 2.
Well, there's no way to make this up to people. I think having to be apart from the ones we love at the moments when we most need them is probably the most painful element of this public health crisis. Mm-hmm. And our heart goes out to everyone who has had to suffer the consequences of that, and people who've had to not be able to hold the people that they love the most closest when they need to do that the most. And people haven't been able to have funerals. They haven't been able to be next to the bedside of their loved ones when they have when they're sick or having other health issues. People have canceled weddings, graduations. It has touched everybody in a very meaningful way, and there's no good answer for that. I know it is probably the thing that is most painful for my husband. Because we hear these stories many times a day, and it is just, it is an awful consequence of trying to battle this insidious virus.
Yeah, for sure. Thanks for answering that. So I'm just kind of going through and seeing what some of the questions are. So pardon me while I glance for a brief moment. We'll take another one. We know that you're really passionate about foster care and children. That's just, a huge passion of yours, Lauren. And, when we think in terms of COVID-19 and impacting kids that are in foster care or need to be removed from one home because of because of their home care needs are in jeopardy, and maybe they need to go into foster care, how are you seeing that impacting the kids that need to be moving through that portion of the system? And this person also wants to thank you for, for your work and trying to, create a silver lining for all of these, in crazy situations that we're all encountering. But, how is that going? How's that process going with your work that you do with children?
Well, yeah, child welfare is something that we all need to keep our eye on. Unfortunately, we're preparing for what we expect to be, unfortunately, a rise in cases. Right now in child welfare across the United States, reporting is down, and reporting of suspected abuse and neglect is down. It's way down. In Massachusetts, it's down 54%. Wow. And that is because mandated reporters, people who normally spend time in direct contact with children, aren't. Teachers, coaches, instructors, the parents of other, their kids' friends. There are no eyes on these children. They're all behind closed doors. So the social workers for the Department of Children and Families are out and making home visits, and they've created virtual visits, and they're doing their very, very best to maintain relationships with these children. But we all know that in times of increased stress in families, unfortunately, the incidence of abuse and neglect increases, and that is probably happening, but we're not seeing it. So, the kids who were already in the system are safe for the most part, and they're being well cared for in the foster care system, or they are in consistent communication with their social workers. But it's the kids that we don't know about yet that I'm most worried about, because there's nothing we can do at this moment.
Right.
We are just preparing to be able to serve as many kids as quickly as we possibly can.
Yeah. Yeah. Likewise, obviously, we're looking at, the challenges are obviously around the odds and ends, right? There's children, and then there's our seniors, and seniors, and being able to visit seniors. So, I know that, Governor Charlie talks about his, his family all the time, and being able to see family. I have a 97-year-old grandmother. She's in assisted living. Haven't seen her in months, other than from a window, and she lives on the 4th floor. So it was like we couldn't see her that easily. And she couldn't see us that easily through the window, but we just tried to wave, and you see like the mocking of the waving to each other as we were dropping off supplies to her at her assisted living community. And it's hard. I would imagine that a lot of the requests for the Massachusetts COVID-19 Foundation dollars, I would imagine, maybe Jonathan, you can help weigh in on this too, that it's really, we're hoping that it's supporting those odds and ends, if you will. Is that where you're seeing a lot of the funding going to, and the sorts of organizations that are requesting dollars going to?
Say that again.
So, like, I know that I have my grandmother, elderly assisted living. There's children, obviously, and, can be in vulnerable situations. When we look at the types of organizations that are requesting dollars from the Massachusetts COVID-19 Foundation, are you seeing that most of them are pertaining to these different age brackets or maybe to veteran groups? Are those the nonprofits that are asking the most of these dollars? Or are there other needs that you're seeing in the community that really is where those funds are being helped to perpetuate?
I think, this fund is focusing on vulnerable populations. So we are, because we're asking that question, we're seeing a lot of requests for immigrants and undocumented populations who are best served by local organizations that they trust. We're seeing, yes, it's kind of across the board. I mean, there's not one particular group, because food insecurity is hitting a wide range of families.
Yeah.
And elders and veterans and the homeless population and everyone. So,
Yep.
the community foundations are looking to organizations in their catchment area that can meet the need of those various vulnerable populations most effectively. So I couldn't say that. Jonathan, do you see anything different than that?
I don't, Lauren. We're seeing large community action agencies like community teamwork in Lowell, to very small grassroots, very embedded immigrant serving organizations that could be in Franklin County, providing
Right.
just basic needs supports of up to $50 per family. So, and it really runs the gamut. But the important thing is that each community, there are organizations that are playing their role, and they're playing their part, which
Right.
is just, it could be serving hundreds and hundreds of individuals and families, or just a small group of individuals or families because of the connections and the relationships they have. And that, I think, is one of the real strengths of this fund, which is to serve those who are in great need, irrespective of where they come from, what their backgrounds are, or
Right.
what their place in society is.
I guess one of the things that I'm worrying about, and I think I noticed something in the chat as well, is, I know that the goal is that eventually the funds run dry, right? That there's no more dollars to give away. But I guess my worry, and I think the worry of the others that have posted similar questions, is I'm not confident that the need's going to go away as quickly as the funds. You're going to distribute the funds. I know, Lauren, you're probably hoping sometime in the summer, Jonathan, that, you get to a point where you feel like the funds have been fully distributed. But if it's true that there could be a second wave as we get closer to the fall again, will this fund be something that could actually be on the rise again, potentially as an opportunity to continue the distribution, to continue to pay forward to families and people of the Commonwealth and the various needs that they'll have? Will the well really just truly just run dry and that will be it?
Well, the first thing is that this fund was specifically designed to be an emergency relief fund. It's time limited, and it will cease to exist. We have raised over $28 million, and we will spend that down rather quickly. And when that last dollar is deployed, the fund will cease to exist. but even that $30 million doesn't come close to filling the need. This $30 million is filling the gap in a lot of places. And despite the fact that this fund will not be around to continue to serve people in need as a result of this COVID-19 health crisis, one thing I'm really proud of is that there are hundreds, if not thousands, of very capable nonprofits throughout the Commonwealth who will continue to serve. And I'm really heartened by the fact that working with Jonathan and the Massachusetts COVID-19 Relief Fund has helped community foundations and, by association, a lot of nonprofits build skills and capacity and experience in serving in a real fast way.
Right.
But those skills and experience and that capacity, all of that will stay with these nonprofits. So I hope that as time goes on, they will continue to grow and strengthen and be better at what they do as a result of being involved with this fund. So I have great confidence in the generosity of the people of Massachusetts to continue to step up to help their neighbors in every city and town with whatever challenges we face. And so I'm confident that while it won't be this fund, it will be another fund, it will be another nonprofit, and we will continue to work as a Commonwealth to to alleviate the suffering and need across our great state.
We've had conversations before, Lauren, and as a Rotarian, I would be remiss if I did not tout some of the things that are happening and tell you about some of the great things that Rotarians are doing across the Commonwealth to make a difference. And I guess my ask to you, after I tell you a little bit more about what we're doing, is, are there other things that we could be doing? I know that obviously making a donation to the fund would be a rock star thing to do. But in addition to that, are there other things that you and Governor Charlie are seeing are the needs that maybe Rotarians haven't participated in, or that I'm not mentioning, that are needs within the Commonwealth that perhaps Rotarians can do? So let me tell you a little bit about what we're up to, or what a lot of the people across the Commonwealth that are Rotarians are up to. That we're people of action, and one of our mottos is is to be people of action. And some of the things that we're doing is in our district 7930, which your hometown is also part of, is we've just done, Governor Joan had a call to action for us to do up to 10,000 acts of peace. And to date, our district has done over 12,000 acts of peace, and those acts of peace have, really run the gamut of what we're doing. There's a lot of Rotarians and a lot of the clubs who are selling signs. You've probably seen them in your neighborhood too, that thank first responders. And Rotarians are selling those, and then they're using those funds to be put towards food pantries, to be put towards things for senior centers, and all sorts. Some of them are buying PPE for their first responders and translating the funds in that regard, or to hospitals and so forth. They're raising funds from that, and they're also using it to donate meals to first responders as well. Earlier, Governor Joan mentioned that we have Scott Dole, who's the CEO, and then David Cochran, who's the President and Chief Operating Officer of the Global Impact Group. These fellows are Rotarians also, and they have created this, really, it's quite extraordinary. And I'm one of the Rotarians, and I know there's several whole host of us that are on this evening that are also have done this also, where we are taking classes through them. They partnered with the Yale School of Public Health, if I'm not mistaken, and they're offering classes. One is a 10-hour class that lets us be prepared to do telehealth work, so we can volunteer as a telehealth person. And then you can also take, if you choose, a 30-hour class that essentially is an assimilated CNA class. So that way we can actually be out there as a volunteer and help alleviate the strain and stress of some of the nurses and caregivers in a variety of settings. It's extraordinary what they did and what they've put together and what they've offered to us as Rotarians to do and participate in. And so I want to give a shout out to my fellow Rotarians in Scott and in David, but also to a shout out to our fellow Rotarians who have taken these classes and are volunteering in that very amazing capacity. And with those examples to you, I wanted you to hear about what we're doing, but also offer to you the opportunity to tell us how else can we, what else are you seeing the need? How else can you cultivate? You've got 60 odd people online with you and eager to just hear how else can we make a difference in our communities? What else is needed?
Well, thank you. Thank you all for all that you do every day. You truly are people of action, and it's impressive to see and hear just some of what you're doing, like this month. And I think it's pretty amazing. And you know this partnership with the Global Impact Group is really interesting to me because you're right. You're ahead of the curve because mental health is a focus right now. And in fact, yesterday I was on a phone call with the governors and first spouses around the U.S. With the president and the first lady, and Melania Trump's initiative, you may have heard about, is called Be Best, and it's all about mental health. And she focuses on young people, children and youth. But her message to all the governors yesterday was that we need to put a great focus in all of our states on helping to eliminate the stigma around mental health, because this pandemic has caused a great deal of trauma and stress, and we need to pay attention to the mental health of the people of the United States, especially our children. And so that initiative and that focus, in conjunction with what we're learning is highly effective telehealth, and the ability to provide significant benefit to patients and people in general through telehealth, that's not going away. That is going to be an ongoing need and an ongoing benefit. We're finding lots of new ways to use this telehealth concept. So the fact that Rotarians are getting ahead of the curve to be able to be qualified in that way is incredible, and I'm grateful to you for that. And I think you can get involved in so many different ways. You already do. One thing I would point out is that a lot of organizations around the Commonwealth who have traditionally counted on volunteers, for example, packing meals for people, or packing groceries for people at the church at the church food pantry or at local, things, food, soup kitchen kinds of places. A lot of the volunteers that those organizations have relied upon are seniors and retired people. And those are the people who are, very much at risk for the COVID-19 virus. And so those people have not been volunteering like they used to.
Mhm.
So these organizations are in need of volunteers who are healthy, who are willing to do what needs to be done to serve this population, whatever it is, wearing a mask, wearing gloves, not being afraid to put themselves out there. So there are a lot of volunteer opportunities that are available.
Are you seeing PPE? Are you seeing the need for things like that, PPE?
Absolutely.
And is that another area where it's just such a shortfall? It's going to be difficult for businesses, for all sorts of nonprofits to almost have this new expense that they weren't thinking was going to be an expense, a line item that they'd have to care about. Is that something that you're seeing is going to be a major need, and perhaps even a way that Rotarians can help in that regard too?
I think that's amazing. Yes, it is. We are going to continue to need PPE of all sorts. And, just last week, I got a request from the Department of Children and Families for 10,000 child-size masks because they need them. They need to be able to give them out. And now summer camps and schools are going to need child-size masks. Well, the supply chain hasn't really been producing great quantities of that because we need a geometric progression more of adult masks. But we need these things, and we're going to have to figure out how to source them. And we need reliable vendors, and we need to make sure that the price that organizations are paying is fair. One thing that I think, if Rotarians want to get involved in that, it would be amazing. We have a lot of people who are figuring out how to 3D print masks and face shields, and people who are sewing cloth masks, which is all a child really needs. So those kinds of things, there are lots of ways to get involved there. And then on mass.gov, under the COVID-19 relief, under the COVID-19 section on mass.gov, there is a resource tab where you can find vendors who are reliable vendors who can produce PPE. So, it might be helpful for Rotarians to figure out and help these nonprofits that they care about source the PPE and make sure that they're not, it takes a bunch of phone calls and a lot of negotiation to secure PPE, and maybe the Rotary could figure out how to put together a sort of a purchasing group. Because if you can put together an order of 1 million or even 100,000, you get a much better price. You guys know this better than I do. Yeah. But one issue that we've been seeing is, we can centrally purchase a large quantity of masks at a great price, but then we have no way of getting them where they need to go. Organizations can't, they don't have trucks or
like a distribution process.
So
Gotcha.
There's a lot of opportunities. And then if none of that works for you, I'm trying really hard to get to $30 million at the MACOVID19ReliefFund.org. MACOVID19ReliefFund.org. Please donate. Everything from $5 to $2 million has been donated by, I think we're over 15,000 donors now, which is really great.
Wow.
really great.
That is awesome. That is awesome. So I hope that everyone, I know that we haven't been able to get to everyone's questions. I hope that we've answered a lot of them. This has been an extraordinary evening, and I appreciate your time. Our First Lady of Massachusetts, Lauren Baker. So congratulations. Thank you for this wonderful evening. We're so thrilled and honored that you were able to join us. And I see Governor Joan coming up right now on your screen.
And Lauren, there was a question, and I will take it because it's the district governor coming after me, Betsy Manzelli, and she wanted to know if we could make cloth masks for children, and where would we send them?
Yes, you can make cloth masks for children. The fact that they're washable is, anybody who has kids knows. They're going to put it on the child, and 3 seconds later, it's going to be on the ground, and whatever. So yes, please make cloth masks, and where to send them. I mean, there isn't like a central repository or anything like that, but every youth serving organization is going to need them. And you can, your local DCF office that's closest to you, the YMCA's, Boys and Girls Clubs, they're all going to need children's masks. There's sort of 3 sizes. There's the little tiny ones, and kids come in all sizes, and so do masks. It's complicated, but if you have the capacity to make a lot of them, like in the thousands, we could, let me know, and I can probably, connect you to the resource guide on the mass.gov. But I think every organization around you will need masks of all sizes, and so just to contact them and donate the masks would be a godsend, so that they don't have to add it to their budget and go out and try to buy it.
Right.
Thank you so much. Well, I just have to say, it's just so delightful to see you again. I just feel you're very connected to our district. I mean, you were at our foundation dinner. You celebrated with us, our community heroes. You celebrated with us as we gave our service dog. And eventually we will pack the backpacks, even if we have masks on and we're 6 feet apart. We still will do that. And now we're together in a crisis. And it's so heartfelt you gave us your time. And, again, to reiterate everything that you are personally doing, as well as Charlie, for the state. And it's just been an honor to have you with us tonight. And I do want to know, in appreciation for you giving us your time, that District 7930 will be making a donation to your fund. And,
thank you.
Fund. So we will, I'm sure, cross paths again. I know, and I again appreciate it. And on behalf of everyone here and fellow Rotarians, please, I'd like to personally thank you and have everyone thank First Lady Lauren Baker for an outstanding fireside chat and presentation this evening. Thank you.
Thank you so much. It's really an honor to be with you all. Your service inspires me all the time, and I keep in touch with Lori, and I'm always hearing the wonderful stories about what you do. And so, thank you. And I want you all to know that the governor just walked by. He's on the phone as usual, but he sends you his greetings and his gratitude for your service to the people of the Commonwealth. So thank you for having me. It's been a pleasure, and I know it won't be too long till I get to see you all again.
Thank you again,
I-
Lauren, and Jonathan too. Thank you for your
Yes,
time
ma'am.
and energy. We appreciate it.
You're
Thanks.
welcome.
Thank you.
Be well,
Have a great
everybody.
evening.
Have a good night.
Bye-bye.
Hi, everyone.
Bye.
Thank you.
Bye.